As many of my friends and colleagues know, since last year I decided to commit myself to a serious scholarly work on the ethics and the epistemology of the so-called anti-COVID vaccines. And I did this not because I wanted to convince anyone to get vaccinated or not get vaccinated. That's not my point. It's never been my point. I did it because I've never witnessed and even envisioned or imagined such a massive attack to honest and serious scholarly debate in the public square, and a massive attack to the democratic system as well. As you know, I'm staying in Italy. I've been here since the pandemic started, and Italy, believe me, has never been like this, and it's tough. It's a serious attack to basic civil liberties and rights. So I actually published already a first book on these issues. Is this one? The main title is kind of complicated, but I'll explain it in a second. The Death of the Phronimos, Faith and Truth about the Anti-COVID Vaccines. The Phronimos is a Greek term, comes from, the way I use it comes from Aristotle. Phronimos is the wise person, is the person with practical wisdom, the person who knows how to act morally the right way. In Christian ethics, this figure, the Phronimos, is Jesus Christ. So what we should do as Christians, when we don't know exactly how to behave, how to act morally, is to ask ourselves, what would Jesus do, right? Because he's the Phronimos, he incarnates the moral truth, and this moral truth shines through his life and actions, right? I wondered, and by the way, this is a book on applied ethics, so don't think that this is just some kind of journalistic approach to what's going on. It's actually a serious work in moral philosophy and epistemology. So I wonder what kind of moral personalities people who talk about the vaccines in the public square right now exhibit. So virtues or vices, which ones? To understand if they are trustworthy in the first place, morally speaking. Then it's also an introduction to philosophy of knowledge, especially from the angle of how we know the truth and how we can know especially the truth when there are people telling us about it. Because in the case of the vaccines, these vaccines, willy-nilly we should trust someone. We should trust the newspapers or the political leaders or some government agencies, or first of all the pharmaceutical industries. So how does our knowledge of the truth work when we need to trust someone about the truth? So in this book I let readers imagine that they are a judge who needs to admit or allow a witness, whether this witness is a political leader or a pharmaceutical industry or science, whatever that means. I try to figure that out in my book. If whether this witness or maybe journalists should be allowed in the trial. This is a very important analogy with our moral conscience. Our moral conscience works the same way as a judge in court. It is not a metaphor, actually. Our conscience works, first of all, in a cognitive way. Our conscience can make a decision about what to do when, first of all, understands and know truthfully all the relevant factors that might affect the morality of our action to people. But the point today is not to talk about this book. There is another one coming in the next days. It's been ready for a little while now. It's just editorial timing that took a little bit more longer, but it's called the Vaccination as an Act of Love, ? And then the epistemology of the ethical choice in times of pandemics, something like that. why do I bring this up? Because the other day I was giving an interview for an Italian journalist who asked me about my book and about what I thought about the situation with these vaccines. And I mentioned actually something just like that. I mean, it was not the main topic of this interview, but I mentioned something which I actually explain in details in my upcoming book, which is about what I consider the original sin of these so-called vaccines, the biggest fraud, as I like to tell, to the informed consent of people. And I noticed that this actually raised a lot of interest, figure things out, which is my main duty as an ethicist. My duty is not to give an answer, but to put people in the right position to make an informed decision, ethically speaking, whether they are individuals or people who need to make a decision for the common good, like politicians or even people in the church. So I thought this was my mission, my commitment. And again, I don't care if people, at the end of the day, they decide to favor the vaccine, at least in some cases. There are different situations. One of the main mistakes about these vaccines has been to consider them as a sort of general tool for anything. But while the vaccine was not born this way. There are several specifications to know about these vaccines. But I don't care about whether people, at the end of the day, they decide to get vaccinated, not get vaccinated. My main concern is that they should be informed about the truth about the vaccines in order to make an informed decision. The way I see, from this viewpoint, the way I see the entire debate about these vaccines, and especially the way in which information about the vaccines has been conveyed through politics and mainstream media to people, has been misleading. It's been a huge fraud, the way I see it. And so I mentioned this original sin, and it raised so much interest that I thought, why shouldn't I mention this also to my English-speaking friends and colleagues? So what this is about? It's about the original documents related to the first emergency use authorization of these vaccines. So let's go back to the original sin time, is December 2020, when the first vaccine was actually emergency approved. I mentioned especially the case of Pfizer, which is the main one, right, among the vaccines, and it's the one that used more people during the pre-authorization trials and studies. Do you remember the public debate, the public news about this? I mean, they used 44,000 people for these studies and these trials. This never happened before. So many people. So science gave its best to react to the pandemics, and so we should trust these vaccines. They are effective, 95%. They have a 95% effectiveness, efficacy. This is the kind of news we were, hearing all over the world about this vaccine. Now, this is misleading. It's highly misleading. It's actually much simpler. I mean, the original documents that they used for the emergency approval, they were not that difficult to read for anyone. So I went back to these documents and I tried to figure out the math about this. And the math tells us an entirely different thing. So I'm going to give you, in this talk, what I would tell people to be sure that they understand what they are choosing when they face this option, vaccine, not vaccine, right? So the way they've been told about this was the 95% effective action of these vaccines, right? Now, what are the real numbers? Okay, real numbers between the placebo group and the vaccinated groups are 18,379 in the unvaccinated group. the placebo ones, and then 18,242 for the vaccinated population. Now, basically, what happened is that these numbers were actually, I'll give you a premise to this discussion. It was already clear before even starting these trials and tests that the statistics of mortality and, ICU and hospitalizations were too low to have serious tests having the results, having appreciable results about these events. So even before starting these studies with Pfizer or Moderna, whatever vaccine, people already knew, scientists knew that these tests and trials couldn't give any sound results or answers to these events. So because if you take a look at the famous Report 9, which is a document that was released after the first wave of the pandemics around March or April, I can't remember exactly the month, but it was an important document that, since scientists would predict at that time at least a 2-year term before having any kind of vaccine, even shortening the usual timing, usually a new drug takes at least 5 years to be tested before before putting it in the market, right? In this case, even trying to shorten this timing, this testing time to 2 years, but in 2020 it was hard to believe that a vaccine could be available before 2 years. So it was important to understand what kind of non-pharmaceutical reactions governments could use. So this document, Report 9, gave several tools available to the governments, social distancing and the masks and all these things we are very well familiar with at this point. But also it gave the numbers, of the real numbers that they could calculate about the pandemics, and real numbers were not that big for people under 70 years old, right? If you look at the infection fatality ratio, for example, it goes from 0.002% to 0.6, from the age groups from 0 to 9 to 50 to 59. So it's if you have 100,000 people, the number of deaths you would expect from COVID-19 is too little to have a real statistic. So in these trials, you didn't have 100,000 people, you had just 44,000. So if you start a trial with 44,000 people, how many deaths would you expect? 10, maybe? So the average the average age of people who took part in these tests was 51. So, and the real data, we know that, right? So during the Pfizer trial, 2 people died in the vaccinated group and 4 in the unvaccinated, so 6 in total. You can immediately get the idea, right? This number is not sufficient to have any kind of result about the efficacy of the vaccine in preventing death. It's 2 versus 4, right? It's nothing. If you shift to the ICU and other serious adverse events, you have something like 13 people who withdrew from the trial because of serious consequences. And you have actually more from the vaccinated group. If I remember correctly, they were 8 versus 5, right? So these numbers, if you look at Report 9 from hospitalization and ICU, you can see that the statistics are so little. It goes from an average of 2% to 5% in that age group, right, involved in the trials. So what I'm telling you is that when they started the trials, they knew already that they couldn't design a trial for having this kind of efficacy So death, hospitalization, ICU, they were off the picture right at the very start. So they were hoping to have some kind of results in terms of efficacy of the vaccine only compared to infection. But again, so how many infected people did they have? Well, you would be surprised. They were 170 people. So 162 out of the unvaccinated group of 18,379 I mentioned before, and 8 out of the vaccinated group. So if you take these numbers compared to the number of people, it's 0.9% compared to the unvaccinated and 0.04 compared to the vaccinated. This means, let's say that you are a person who are asking me as an expert, what's your chance to get infected? I would tell you, if I call your situation not being vaccinated, X, for example, I can tell you that being X, you have a protection which is 99.1% from being infected. So 0.9 is less than 1%. So you are naturally protected in a sense, 99.1%. And if you get vaccinated, you are protected 99.9%. So you have just a 0.05% of chance of getting infected. So if I compare the numbers to the entire population involved in the trial, I can tell you that if you get vaccinated, your chance improve 0.86%. This is an average, of course, but 0.86% is nothing. This is the efficacy of the vaccine compared to the entire group of people, compared to the pandemics. Now, what about the 95% efficacy? Well, that was calculated compared not to the entire number of people, not to the pandemics, but to the 170 people who got infected. So if you forget about the numbers of the trials, the 44,000 people, and consider the 100%, just about the 170 people, you see 170 is to 100, as for example 8 is to X, right? At that point you can say that there is a certainly it's a 5%, 95% efficacy for the vaccinated. This number has nothing to do with my real chance or real protection. So it's like, to use the example, the analogy I use in my book. Okay, let's put it this way. Let's say you have a nice house in Florida, right? And a construction engineer comes to you and tells you, you know what, if you use this new type of brick or lime or mortar, whatever, for your house to renovate your entire house, you will be 95% protected from hurricanes. You would say, wow, okay, that's actually a very strong protection against hurricane. That means if a hurricane comes, there is only a 5% chance that my house will be destroyed by the hurricane. Well, that's pretty good deal, right? So let's do it. Let's renovate the house. The engineer also adds, you know what? These are also new material. They haven't been tested properly. So you have a 95% protection, but the house might be damaged eventually, the entire structure of the house. There is a risk, an unknown risk. There is no way to calculate exactly this risk because it's unknown, right? So, but you would still say, wow, okay, there is an unknown, a big one, but 95% protection from hurricane is still a good deal, so let's do it. Fine, but what if the engineer tells you something different, tells you, you know what, as things stand right now, your house, as it is already 99.1% protected against hurricanes. So if a hurricane comes, there is only a 0.9% chance that the house will be damaged or destroyed. Now, if you renovate the house using these new bricks, lime, or whatever, the house will be protected with a 0.8% extra protection. But still you have the risk of these new products damaging the house in the long term. Because, by the way, the only test we've done, and this is true for the Pfizer tests, it's only 2 months long. I mean, the average monitoring time for people in the trial were 2 months. So even in the official documents, there was an unknown after 2 months. So you get the 2-month protection of 0.86 more. I mean, who would renovate the house in Florida with this kind of, little, very insignificant percentage? But this is a real informed consent we should tell people about. We should have told people at that time, because really they put in the market something which a ridiculous advantage point of 0.86%. Now, the ethical question is this. If you knew that your marginal advantage from the vaccine was 0.86%, and you had already, in that age group at least, involved in the trials, had something like 99.1% natural protection, who would choose to get this vaccine facing unknown risks from the future, right? Because when you have an emergency use authorization, what you need to balance, ethically speaking, because this is, I want this to be clear, that political choice to pass an emergency authorization on a drug is an ethical balance between giving up safety protocols, which would take 5 years, more or less, because of such an amazing efficacy of this drug to fight a national emergency, right? That should have been declared by the public relevant authorities, but in every state, of course, according to national laws. But so, since we have a national emergency and this drug promises to be so effective in this fight, I'm willing, ethically, to give up safety, right? But because it's a real risk, I'm breaking all protocols of safety in this case, but the efficacy should be really big. That's why it was presented as 95% efficacy. But if this is the efficacy, this is not worth the effort, right? It's not worth giving up safety. So to me, this is a fraud. If we really looked at the real numbers, we would never, any of us, when I say we, I mean we who really are in a position to evaluate, to make our own decision. Nobody would accept this, right? But they wanted to. There was a political pressure. There were so many billions at stake, right? They needed to, but they didn't give us the real numbers. Now, this is the original sin. Now, if you understand how weak the science of this efficacy was, you also understand why this science kept changing, month by month, week by week. To me, there is nothing so weaker than this science. Science usually is about prediction. When there is real science, especially experimental science, you are pretty much sure about what's going on, what's going to happen. When things change so much, it's because science is weak. There's no other way to put it, right? If science is weak, prediction is faulty, and things are unpredictable. But science was weak because there was no real science behind these emergency use authorizations. And I'm not even getting to the issue of secrecy of all the relevant documents and trials. I'm just talking about the official documents we can all read from the FDA. So if you look, this is not an interpretation, by the way. If you really look at the documents, the real documents, you will find that all these things I've been telling you are unknowns. I'm reading you quickly some lines from the documents that actually was given to the FDA advisory committee to evaluate the vaccine. So there is a huge list of unknowns, right? But for example, duration of protection is one of unknowns. It is not possible to assess sustained efficacy over a period longer than 2 months. So we know 2 months is already written there. Immunocompromised is too small to evaluate efficacy outcomes. I mean, the subset of certain groups, such as immunocompromised individuals, is too small to evaluate efficacy outcomes. So we don't know if this vaccine will be effective with immunocompromised or other subgroups, like, for example, pregnant women or people with already previous infections. Available data are insufficient to make conclusions about benefit in individuals with prior SARS-CoV-2 infection. Pediatric population, of course, I mean, younger than 16 were not even involved in the trial, so no question about that. There is a huge unknown about the development of the pandemic, so I don't even want to get into this because it's a fraud in the fraud, but it's too long to explain in this video. Then there is the asymptomatic infection. Data are limited to assess the effect of the vaccine against asymptomatic infection. Now, to me, this is a big deal, because if you cannot tell the entire population, the government, that this vaccine is effective with asymptomatic population, you're telling me that even putting it into the market may not really affect the pandemic. So I wonder why this was not really raised as a very serious issue at the moment of approving this drug. Now, long-term efficacy on the effects of COVID-19 disease may have long-term effects on certain organs, and at present it is not possible to assess whether the vaccine will have an impact on specific long-term sequelae of COVID-19 disease in individuals who are infected despite vaccination. So you get vaccinated, you get infected, we have no idea what's going to happen to you, right? But you can get infected and you can have long-term consequences we don't know about. Efficacy on mortality. A larger number of individuals at high risk of COVID-19 and higher attack rates would be needed to confirm efficacy of the vaccine against mortality, what I told you before, right? So they knew it. So this is another huge unknown. So if you got the idea when you were offered the vaccine early in 2021 that this would actually reduce the chance of dying out of COVID-19, okay, you've been misled big time. Efficacy on the transmission of the virus. Data are limited to assess the effect of the vaccine against transmission of SARS-CoV-2 from individuals who are infected despite vaccination. So you get the vaccine, you get infected, you can transmit the virus or not, we don't know. By the way, this has never changed. If you read the official documents, both from the FDA and EMA in Europe, it will still tell you that this is an unknown. So if you think about all the official government's action that were based on the assumption that these vaccines would reduce the transmission of SARS-CoV-2, you understand how big this fraud was. Because when they have to legally write it in the official documents, they would tell you that this is an unknown. When they use their propaganda to justify some public measures, they will tell you that, sure, of course, I mean, you get vaccinated, no problem. Transmission of the virus is off the picture. Okay, I'll stop here, but I want just to be sure that you understand that I was reading from the official documents, not from some anti-vaxxer sites. And again, my point is not to tell people not to get vaccinated. In my family, some people with special weaknesses. I mean, we advised even, without any special objection, to get vaccinated. I mean, but the risk balance, of course, changes a lot according to the age, right? The problem is that all the trials were, done with people who were much stronger, with no comorbidities, who could resist much better to all, both to the effects of COVID-19 and to the effects of the vaccines, right? Because it's better to have healthy people in trials because you don't see they resist better even to the possible negative effects of the drug. Is a strategy, right? To have more positive results than negative. But my point is this one again, and I'll go back to the main point, right? So what would be the right informed consent in the case of these vaccines? First of all, I mean, I doubt strongly that there were enough data to give this authorization. The emergency use authorization, I think it's a fraud itself. But even if you do it, what kind of informed consent you should tell people? Because before the emergency use authorization, you were a voluntary person in a human experiment trial. After the emergency use authorization, you are still in an experiment because the testing of the drug is still an ongoing thing. But I should tell you what I know about this drug, exactly, because you are a human lab rat too, right? So it's true that it's a human experimentation. You need to be informed about this. I should tell you both that there is an emergency use authorization. This is not a regular drug, but then I should tell you exactly what your risks are getting vaccinated and not getting vaccinated. 95% is a fraud. It's just misleading you about the drug.